next question, Karol, I'm going to come to you first, and then Kaylene, I'm going to come to you next. I'd like to hear about looking back with that screening and diagnosis portion. Is there anything that you wish you had known?
I wish that I've known to do the 3D mammogram instead of the 2D, because then I felt like, well, maybe if I did the 3D, he would have said, yes, you do have breast cancer. And after talking to everybody, a lot of people do the 3D mammogram. So now I know to do that.
Karol, do you feel like you got a delay in diagnosis because of the 2D versus the 3D?
Yes, I do.
How much of a delay?
When I did the mammogram, even the year before, they said it was something, but it wasn't anything to worry about. So it was
Oh,
so it was something there all along, but they were never concerned because again, I went to that same facility. And I think if I had went somewhere else, they would have caught it even a year before. So I think by me hitting my breasts, that was just an eye opener to say you need to really get it checked out.
I didn't know that part of it either, that you'd
Yeah,
had the mammogram the year before
yeah,
and they basically said, "Oh, we see something there, but don't
yeah,
worry about it."
yeah, exactly.
I'm so glad second time around that
Mm-hmm.
you you pushed forward and
Yes.
went and got a different opinion.
With my own mom, the way they found her breast cancer, she fell down when she was putting a sign in the yard. She was a realtor, and it hit her right in the breast. And it was the same thing. That's how she found hers because the pain just didn't go away. And I think it's a strange sort of coincidence and certainly a good one sometimes when it leads to a diagnosis so that you can be treated.
Aileen, I'd like to come to you next. Is there, looking back, is there anything that you wish you would have known?
I knew this, but it was just something that wasn't in my face. But I do wish that I had been performing monthly self checks because they tell you to do it, and it's like, yeah, but I'm a new, I was not a new mom. I mean, my daughter was my second child, but I was a working mom who, was going through a lot of stuff. And um and you're thinking like, oh, like I'm breastfeeding, like I'm touching my breasts all the time, but you're not touching it in a way that is with that purpose, because honestly, Karol had mentioned like the size of her tumor. Mine was very large. Mine was over 5 centimeters. And like to not realize that it was there I mean, like it didn't just go from 0 to 5 centimeters, it obviously had been there for months, if not longer. And it was just one of those things that with the timing of when I had my daughter and when they do your annual exams, I had a follow up after she was born, and then I missed my annual exam at the regular time where there usually would be somebody else doing that. So I honestly was due to have my annual around the same time that I found this. So it's like, it's just, I don't know. I feel that there is, stuff out there, but it's just, maybe it's just something else to remind new mom, don't forget this portion, this for yourself. You're so busy taking care of it. Maybe, we do the depression screening so much at like pediatrician follow-ups and things like that. Maybe it's just another, hey, we could throw this in with, the spot checks postpartum and, remember to do this. This is still important for you.
I think that's such an important point. And to your point, I think as someone who was a breastfeeding individual as well, your breast tissue changes so much during that process that you think like, oh, well, how would this help? But the truth is, it's not, it is absolutely just about familiarizing yourself with the way things are supposed to feel, because anything abnormal will feel abnormal. It won't feel, like your usual clogged ducts or, tightness. And I think that's important for OBGYNs and PCPs to remember. And yes, like you said, maybe even pediatricians to remember to remind moms to do.
Mm-hmm. Absolutely.
I think it's really fantastic that you bring that up, because I'm fortunate in that I have not had to have the experience of fighting cancer. I do remember in my breastfeeding journey there being a lot of issues with clogged ducts. So, yes, there were the bumps that would happen, but those go away. The tumors don't. So,
Mm-hmm.
I really love that you had doctors that took it seriously.
Yes. And to know that mastitis comes with a fever is also really important.
So, with this final question, um, Kaylene, I'll start with you, and then Karol will end with you. I'd really love to hear about, in that screening and diagnosis piece, what were the things that you really appreciated and that made your life easier, particularly as you did the screening and diagnosis, and then as you looked ahead on embarking on the journey next of the care plan, the treatments, the daunting road ahead, basically.
I mean, for me, I'm just appreciative of like how quickly they process the things, and that, and who knows if maybe it was just like the time of year that, that I got diagnosed or whatever, that there weren't as many screenings because it was summertime, maybe, people do vacation, whatever. But I was just appreciative that it was okay. Yes, I had a long wait to get in for that diagnostic, and um but that once I was there, like, that that doctor's there to read that report right away, and that they didn't just dismiss it. Or I will say, at no point did any of the doctors that I spoke with downplay it, or they weren't alarmist, but they were very factual about everything. And I appreciate that, because sometimes you get the, oh, don't worry about it, like somebody's just trying to make you feel better. But that's not, in that moment, you don't ever want to feel like you're being dismissed, even if it's with good intentions. So I can say that I appreciated that. And outside of like the random OBGYN doctor that I had to like speak to first, I will say I appreciated that everybody I dealt with was women. Every doctor was a woman that I worked with. Like, all, like I think that helps inform their approach to care, whether they want to, you know, admit it or not. I think, like, for me, I just felt more comfortable and more seen and heard in those things, and just more validated about my concerns. Um, and then once I had that site check that turned into that, like, just to be able to have the support right there, like, there was a nurse navigator waiting in that room for me to hold my hand through the next steps. There was a nurse, to do those things. They came in with, you know, all their weapons, so to speak, of like, or my support team, my weapons, and getting to the next steps, which was, I was very, very grateful for.
Kind of follow up on that. Um, you'd mentioned your husband earlier. You'd mentioned the help with the nurse navigator. We've heard from some panelists about how they had people with them from the start of that process and kind of walking through that process to maybe take notes or help them digest things. I know Charlotte did that for her own mother. Did you find that kind of support either through clinicians, friends, family, both?
Well, I mean, my husband was there, but with two little kids, yeah, I was just grateful mostly that he took over, like, thinking about the things that I didn't have the bandwidth to think about at that time, that he, took care of the kids, and everything. And admittedly, I would have gone to my mom for this, but at the same time, that I was getting my diagnosis, my mom was battling stage 4 cancer, and her husband, my stepdad, had also just gotten a prostate cancer diagnosis. So I actually felt that I couldn't go to my mom at that time until I knew everything. Um, and so I didn't say anything to her when I like found my mom. It was actually killing me to not be able to talk to my mom about it. Um, and once I had my official diagnosis, going over there to have that conversation, like once I did talk to her about it, I had, a lot of support from her. I mean, even though she was battling her own cancer, she luckily was at a point where like she was pretty stable. She wasn't going through a lot of active treatment, but um, like it, to have all that, and then like I did appreciate my nurse navigator a lot in the beginning too, because she was basically like, hey, you're going to schedule this, you're going to do this, and I know they're going to tell you you can't, but I'm going to tell you to say this because you can. And it was really helpful
Can
to
you give
have.
us an example of one of those things that nurse navigator told you about? And thank you for being vulnerable enough to share. I'm so sorry that that was all happening simultaneously. I know
Oh,
you kid, you're kind of already in survival mode.
yep. Yeah, at one point, like just to go back, at one point, my stepdad and I were scheduled to have our surgeries on the same exact day. And my mom was like, no, you can't do that to me. But that's for another time. But right. So what happened, like at that appointment, once I was sitting there and she's like, okay, we're going to go to do the next steps. This was also all right before like Labor Day. So short weeks, vacation, stuff coming up where it was going to just be hard to get in to see the people that I needed to see. So they knew based on the characteristics of my thing that the first person I probably should meet with would be a surgeon rather than oncology or radiology. Basically, I was going to be able to see the surgeon on like a Wednesday, or that Thursday they were offering a multidisciplinary conference where I could meet with the radiologist, the surgeon, and the oncologist all at once, and basically like a tumor board, like they would all kind of have a little time with me, talk to me. Um, but what I had to schedule prior to either of those meetings was an MRI of my breasts. And they were like, you need this done. They're going to tell you that they don't have any openings, that it's going to need to take longer. We know that there are openings specifically for cases like this, that we want to get in sooner. And she said they're all like, normally when you're scheduling with an MRI too, they for breast MRI, and you're still menstruating, they want to know like how close you are to your cycle. And they said, we don't care about that. Like they're going to ask you the dates of your last cycle. Like we what we care about is you getting this in before the MDC, so that way like we can see this information. And I said, okay. So I had to call like the central scheduling department, and I got the pushback that my nurse navigator like explained. And they were like, well, we don't have any like appointments. And then I was like, yeah, I was told you were going to say that. But I'm supposed to tell you like, they know that there's openings, like they're really trying to get me in. And then they asked me like the date of my last period, which like, honestly, like at that point, like my stuff was all over the place. So I was like, I don't know what you want me to tell you, when they wouldn't schedule me. So I called my nurse navigator back and I was like, they won't get me in before that. And she was like, yeah, I'll take care of this. And then
Huh.
she called me back like an hour later and she said, you're going to get a call. If you don't get a call in the next 30 minutes, let me know. Somebody called me and they had all the backstory, and magically they had an opening for the following week for me. So, I mean, she knew how it was going to play out, and I am super appreciative that she was there to just help me not fall behind in moving things forward. So
I love that. That's a beautiful example of the unnecessary friction that we deal with in our healthcare system sometimes, but then someone on that clinical relationship side stepping in and making a difference that really matters. I'm so glad that you had that.
I'd also like to add that I'm so glad that happened for you, but I consistently think about my own experience, and the fact that I went to other health networks when I was told that. No one told me that I could get triaged into the MRI system.
And I don't know that all health systems function the way in the triage MRI system, but I do also know your story, and I do know that particularly when dealing with cancer, there is a very serious time consideration.
We went to the same system, so it did not work the same way for everyone.
Okay.
Yeah.
Then
I'm glad that you shared that, though, Kaylene, because that is so important for people to know, not just that they should have a triage system. If they don't, go to a different hospital. You can take your prescription anywhere where they accept your insurance, anything to keep it so that you can get treatment more quickly.
Karol, coming
Yes.
to you next.
Yes.
Would love to hear about anything that you particularly appreciated in that beginning screening diagnosis portion of the journey, and anything that made your life easier in that.
Mine was my doctors. I mean, immediately when she told me that I had breast cancer, her thing was, I got you from this point on. You don't have to worry about anything.
Real
As I
quick,
was
was that your primary care or your oncologist?
my
I know
oncologist.
okay. Okay.
So as I was leaving from my son's graduation, my primary care doctor called me and said, I got the news. And her first thing was, here's my cell phone number, my personal cell phone. I know you're not going to abuse it, but if you need me for anything, don't hesitate to call me. And that made me feel like, wow, she was there with me and understood what I was going through. Along with that, I had a lot of parents that was doctors here at my daycare. I had a radiologist doctor that looked at my records, and I had a parent that went through what I went through, and she looked at everything. I had a parent that was a nurse that could even pull up my records and say, this is what's going on. So I had a lot of people behind me medically that, even though my doctors, my oncologist told me this what was going on, my parents could look and tell me, yep, she's right. So they're always like, if you have any questions, don't hesitate. And so as I was going through that journey, all of my parents was there behind me, 100%. So I didn't feel like I was lost in the shuffle. Um, they stood behind me, and I could ask any question. And then my oncologists, and they were there. So I had a big team, with me. So I didn't feel too scared going through this. And then when she referred me to my oncologist to start my chemo, she was awesome. And again, all of my doctors were women too. So it's like they understood, what I was going through. So I felt it was like December of 2023 up until just May of May of last year. And it seemed like that time went by so quick.
I love how both of you had care teams that showed up. Karol, kind of following up on that, you mentioned the parents in at your daycare. You mentioned your son.
Mm-hmm.
Did you have a nurse navigator? Anyone to help you take notes and appointments, or help make some of the friction points easier? Where did you lean on for that support?
Really, my parents. My parents is who I leaned on, and especially one that went through like a couple of years before me. Um, she came in and she could tell me exactly what I was going to go through. And so that really helped me along. But also my nurses, that when I was doing chemo, they would to call and just check to see how I was doing. Do you need anything? And that it just meant a lot. So since I have been cancer free, I kind of go back there and I kind of make, cancer bags for little things with hand sanitizer, all kind of stuff that you don't think about until you go through it. So I make bags for your hat, for your head, because when you lose your hair, your head get cold. Hand sanitizer, snacks, and so every 3 months I make new goodie bags and take it to the hospital for them to give out to other patients.
That's amazing.
I love that. I and I just want to take a moment and say thank you both for being willing to dive in and be vulnerable and revisit something that was emotionally very difficult. Our hope is that with the stories that you're sharing, we can, kind of like that parent did for you, Karol, who had experienced it and could tell you what to expect.
Mm-hmm.
Our hope is that we can take these stories and offer that for people who may not have that in their own network.
That's right.
For me, I am the first one in my family that had breast cancer.
So no family history.
No family history. I have more, and my mom had passed away, so I didn't have my mom to talk to. But it was amazing that nobody in my family had breast cancer. So now, I tell my cousins, make sure you guys get a mammogram, because after that, it could be, make sure that they don't go through what I went through.
Thank you for helping to spread awareness.
Any final thoughts that either of you would like to share?
Well, so, like, if you want to, I'll touch back on the support thing too, because she was saying, like, no family, and that was the same thing. Like, I had no family history. I mean, they ran all the genetics and stuff, but I'll say, like, one of the big things for me that was so helpful, like, even like knowing my diagnosis and everything, was actually like online communities of like moms and things where it's like, that's how I got introduced to Charlotte. Was not, it was just, hey, this really sucks right now. Like, what do we do? And it was like, oh, hey, like, there's a group, and, just people who went through it, having those peers. Because, like, I will say, like, I worked with 2 different health networks throughout, like, my surgeries and chemo and everything. But both of them were like, oh, we have peer-to-peer networks we can connect you with. And I will say, I requested that from both of them, and neither of them delivered on it.
Wow.
So I could still, in the one, I can still see in my portal, it's like a request waiting there for like social work to handle, which I don't want to, say anything to the social work, because otherwise they have been amazing, but it's like that request somehow got buried and never handled. So just to be able to like find other women that are similar in age, like similar life experience, to see how they're dealing with it and what they learned, or like, just, it is very helpful to have. You don't want to meet, you feel bad being like, hey, I'm trying to meet people who had cancer, but it's really nice to go through that. And now, like now I'm at the point where, like, now I'm that person to other people, and it's like, this is a really crappy, like, graduating class to be a part of, but like, do like that, like, I can model that and be someone's go-to for, like, hey, like, did this happen to you, and be on the other side of that now.
But it
So
but it is nice, right, to be on the other side of that and
yes,
to have gone through so much and know that maybe it can help someone else, right?
absolutely.
Thank you all. The community aspect, I think, it just goes to show you that that has been a theme that has been in every single one of these, that the community portion of this is so important. And for those who do not have it, we're really hoping that this will provide them that sort of mentorship that they're looking for, that they may not. I feel like when you meet other survivors, sometimes there's this feeling that you get that you never knew that you needed when you get a chance to talk to them, So important.
Karol, any final thoughts?
My final thought is, now I know, I had breast cancer, and I tell anybody, women, even women here at work, going through this, and they were there for me. Their thing is, I got to go get a mammogram. I got to get a mammogram. I was like, yes, please do, because in my wildest dream, I would never thought that I would have gotten breast cancer, but God gave it. I got it, I survived it. And so now I tell everybody else, if family members, make sure, you get your exams, go to the doctor, do what you have to do, and advocate for yourself. So,
Yes. And for
yes,
every one of us that shares that, we're changing somebody's life. So
yes,
just keep on doing what you're doing.
yes.
Yes.
One of my friends, as Caitlin know, I quilt. I'm a quilter, and I go on retreats, And so one of my friends, she's a lot younger than me, and she ended up with it. And when I went to my very first chemo thing, she was like, I'm going there with you. And I was like, okay, so she and I talk about it, but you definitely have to advocate for yourself.
Thank you both so
Thank you.
much.
Thank you. Thank you for inviting me.
Yes.
Yes.
So honored that you shared your stories with us.
We really appreciate it. Thank you both so much.
Thank you.
Well,
We'd like to give a big thank you to our guests, and we hope that you'll join us for the next episode. Context is everything, and healthcare and life. If you believe in what we're doing and want to support us, please remember to like, subscribe, and share our channel. Reach out if you want to be on our show, or you think we should cover another topic. What did you learn from the show today? We want to hear from you. Contact us at hcincontext@gmail.com. Leave a comment or look us up at wellnesscommunities.com. One of the most common questions I get asked as a cancer survivor is, what should I send to my loved one who was recently diagnosed? So that's why I helped create a curated list of products at wellnesscommunities.com in the Shop tab. It contains products that are tested and recommended by the people on our show, including me. We'll take a portion of proceeds and donate it to Undo Medical Debt. For every dollar donated, it will pay off $100 of debt. It also helps us continue to share these stories with you. We wish you wellness. And if you aren't feeling well, remember, there are people out there working hard to make you feel better. See you soon. Until then, take care of yourself and stay cozy.